There are 163 new COVID-19 cases in the community to report today. Of these, 159 are in Auckland and 4 are in Waikato. These new cases take our total cases in this outbreak to more than 4,000, now sitting at 4,034, of which 1,723 have now recovered. There are also 4 new cases in managed isolation, 2 new cases and 2 historical cases. Further details are in our statement. Today we are also sadly reporting a second death in the community of a person who was isolating at home with COVID-19. The Ministry's condolences are with this person's whānau at this sad time. St John's attended a call this morning for an emergency call to an address in the suburb of Mount Eden and found the person deceased on arrival. The man is understood to have been recently treated in hospital. Health authorities in Auckland are working with the police and ambulance to review the circumstances around the death. Both deaths reported this week are being investigated as part of a wider joint systemic review in collaboration between the Ministry of Health and the Auckland District Health Boards about the home isolation of COVID-19 patients in order to identify any improvements that may be needed to the system. And both deaths will be examined through the coronial process. On hospitalizations, there are 69 people in hospital with COVID-19. All except one are in Auckland, the other person is in Waikato Hospital. 6 of these patients are in ICU or a high dependency ward. Just back to Auckland, given the number of new and active community cases of COVID-19 in Auckland, our approach has shifted from listing every location of interest to focusing on high-risk events. These are exposures where there are likely to be close contacts of a positive case. Low-risk exposure events such as drive-thrus or supermarkets are no longer being reported as locations of interest in Auckland because the public health risk is very low. We will continue to publish higher risk, close contact exposure events in public spaces when they occur, such as gyms or indoor recreation centres or movie theatres. That's clearly not the case in Auckland at the moment. And we're also looking at providing a much better improved map function so that it's easier to see hotspots in specific areas. We will continue to publish casual exposure events in other parts of New Zealand because there are currently much fewer of those. And it's important that anyone, regardless where you are in the country, continue to keep a record of where you've been, use the Tracer app, and that really does help us to fast-track our ability to contact, trace, and respond to those situations. Just an update on Northland. We are continuing to encourage people who live in or around Taipa, Kangaroa, Awanui and Kaitaia to get tested if they have had symptoms of COVID-19 in the last couple of weeks. There are 10 community testing centres and 9 vaccination clinics available across the region today. Locations for both of those can be found on Northland District Health Board's website. And there were over 1,000 tests taken across Northland yesterday and 1,285 vaccinations given, including 378 first doses. Just an update on Waikato. There are 4, as I said earlier, there are 4 new cases confirmed in the Waikato overnight, 1 each in Hamilton, Te Awamutu, Ngāriawahia and Te Kuiti. 3 new cases are linked to other known cases. There's 1 case in Te Awamutu that is still being investigated by Public Health. And again, we urge anyone in the Waikato with COVID-19 symptoms, no matter how mild, to please get tested, even if you are vaccinated. 1 patient remains in Waikato Hospital in a stable condition. Just an update on Taranaki. Last night, the Ministry was notified of a wastewater detection in Stratford in Taranaki. Public health officials have not yet linked that detection to a known active case in Taranaki. So we're asking anyone in Taranaki with symptoms that could be COVID to get tested. Testing and vaccination sites are available on the DHB website, the Taranaki DHB website. Testing is really important to help us determine whether there's any undetected cases in that community. The vaccination rates are 85% for first doses and 68% for second doses. So the wastewater result is a reminder that if you haven't yet been vaccinated in Taranaki, get vaccinated. And finally, I'd like to encourage everyone who received their first vaccination 3 weeks ago on Super Saturday, October the 16th, to get their second dose this weekend or as soon as possible after that. Everyone vaccinated for the first time during Super Saturday will be getting email and text reminders to get their second shot. So please go and get one to protect yourself, your friends and your whānau. People in Auckland can also head to Eden Park, which will be open for vaccinations over the weekend. And we're calling on anyone else over the age of 12 who hasn't yet been vaccinated to get their shot. There are hundreds of clinics open all over New Zealand this weekend, including drive-through and walk-in options. It's never been easier.
Since the outbreak began on the 17th of August, we have paid out $5.3 billion in economic support via the wage subsidy and the resurgence support payment. We are now into the 6th round of the wage subsidy since August, and as at this morning, 993,733 applications have been approved, with $3.9 billion paid out. So far, 1,106,686 employees have received the wage subsidy, and 331,153 businesses have been supported with one or more of the wage subsidy payments. The 7th round of the wage subsidy will open next Friday, November the 12th. Also opening on that day is the first double payment of the resurgence support payment. This will be the payment that will be at a rate of $3,000 per business and $800 per FTE, up to a maximum of $43,000. As at yesterday, we had paid out $1.357 billion through the RSP, covering 471,566 applications.